Good morning, everyone. I am Dr. Ramkumar, plastic and cosmetic surgeon at Vinita Hospital, Chennai. Today, we are going to discuss about a very common cosmetic procedure, which is a chemical peel. People want it for rejuvenation of the face. We would like to take a few questions on this, and also we would like to do a procedure, a live procedure, so that it's meant for education of the common public. In a chemical peel, certain substances are applied on the face so that there is a removal of the superficial layer of the epidermis. Normally, these substances are acidic, for example, glycolic acid or a trichloroacetic acid, in varying strengths depending on the skin condition of the patient. Before starting the procedure, we assess the general health of the patient. We also assess the skin if the patient has any pre-existing skin condition which will preclude any chemical peeling procedure for the patient, like atopic dermatitis or systemic lupus erythematosus. And then we take up the patient for the chemical peel procedure based on the requirement. We assess what concentration of the peel should be applied, and then we select the appropriate agent and do the procedure. After the procedure, the patient is instructed for a proper post-care, which includes use of a sunscreen. After a chemical peel, you can expect a mild exfoliation or a mild burning, sometimes a mild frosting or scaling of the skin. We should always take adequate measures to prevent exposure to direct sunlight for at least 4 days or 7 days, up to a week. Even in those days, we should be using a sunscreen, and then there should be a continuous use of a sunscreen. In fact, we ask the patients to get into the habit of using sunscreen even before doing this procedure, so that they can continue with the same after the procedure. Then we give them appropriate medications if there is a complication. Normally we do not have complications. For Indians in skin types, we use starting from glycolic acid to trichloroacetic acid. Or whatever agent is used, we give them the proper advice as required. You can expect a glowing effect on the facial skin even after a matter of few days or immediately also. When we repeat the procedure at definite intervals, for a very mild peel it can be a weekly interval, or for a stronger peel it could be 2 to 3 week interval or 1 month interval. We have to repeat the procedure 3 to 4 times. Then what happens is the superficial layer of skin becomes compact. There are changes under the layer which improves the dermal collagen, and there is a general improvement in fine wrinkles. The acne patients, their problem gets improved, and for some patients the fine wrinkles, also the superficial pigmentation problems also, they improve. So there are certain benefits we can expect after the procedure. Sensitivity is a very important problem. As I said earlier, some patients have pre-existing dermatologic problems like atopic dermatitis, systemic lupus erythematosus, certain definite skin allergies. We tend to avoid this procedure for those patients. So apart from that, if our Indian population, almost all of them can have this procedure. As I said, if you had noted, repeat of any peel should be done after a definite interval. Some people think that it can be done daily. This should be discouraged. Normally the interval is 2 to 3 weeks. It could be slightly shorter if it is a very mild agent. We can make it as a weekly once. So any peel procedure for 3 to 4 or up to 6 times, if you repeat it, there is a long-lasting effect, which is a positive effect, which is observed by the patient. Chemical peel is a very safe procedure. It can be used for almost all of the population, except in a few who have specific skin conditions. Apart from that, it's a very safe procedure in the hands of a trained professional that you can have a excellent result. Thank you. We're applying Vaseline to certain areas where the peeling agent tends to accumulate to prevent any deeper injuries. This patient has a few acne and post-acne scars and some areas of spots of hyperpigmentation. So we are using an appropriate low efficacy, low percentage or 25% glycolic acid for this patient. So we are using an appropriate percentage of glycolic acid, 25% for this patient. We just go for the application. We are applying neutralizer. We have cleaned the peeling agent, we have washed the face, and we have applied a layer of sunscreen. So that's the completion of the procedure.